Hari Om. Welcome to Yoga Vidya Gurukul, YogaPoint, Yoga Therapy Training Program. We will be talking about diabetes mellitus, or in short, diabetes. Now, diabetes is a condition, is a disorder, a chronic disorder of the metabolism in our body, and at the same time, the endocrine system, the endocrine gland, pancreas in our body. So it's a disturbance of metabolism and it's a disturbance of endocrine system, in particular the function of pancreas, and it causes hyperglycemia or high levels of sugar in our blood, glycosuria, sugar in our urine, and can also lead to hyperlipidemia, that is excessive levels of lipids. Now diabetes is considered as most commonest disorder of the endocrine system, and it is basically characterized by increased blood sugar levels. In many cases, the cause for diabetes is unknown, and so we call it as idiopathic. Where there is no known cause or it's an effect of multiple lifestyle factors, then we would say that the cause of diabetes is not specifically known or idiopathic. In most of the cases, diabetes can be hereditary because there is a positive family history in nearly 40% of cases that someone in the family is suffering from diabetes. So, definitely, there is a strong hereditary tendency, there is a strong family tendency for the occurrence of diabetes. Sometimes genetically also, some people are predisposed to diabetes if there are problems with the chromosome number 11, 19, or 1. So this disease can also be genetically transmitted because of the abnormalities of these chromosomes. Aging factor is also considered to be one of the risk for diabetes. As the age increases, the pancreas, particularly the beta cells of the pancreas, can be destroyed or the functions of these cells can reduce. So if these cells they are destroyed or the function is reduced, then the production of insulin is also reduced, which can lead to diabetes, high sugar levels. Another reason can be pancreatic disorders or destruction of pancreas. It can be pancreatitis, inflammation of the pancreas, or even infections, some viral infections of the pancreas, or there can be destruction of pancreas because of alcohol and various other drugs. So, any condition leading to destruction or any disorder of the pancreas will disturb the production of insulin secretion and will disturb the sugar metabolism, the glucose metabolism in our body, leading to diabetes. In some cases, the insulin is produced in enough quantities, but the insulin which is produced can be defective. It's not completely functional. So the quantity of insulin can be normal, but functionally it is not effective. So a defect in the insulin formation can also be the reason of diabetes. And furthermore, if the insulin receptors over the body cells, if they are damaged or if they are not working properly, it can lead to diabetes. And in some cases, diabetes can be because of autoimmune disorders. There can be antibody formation against our own pancreas, which will destroy the pancreas, leading to deficient secretion of insulin, which further leads to diabetes. So there can be multiple factors, multiple causes which can lead to diabetes, less insulin secretion or defective insulin secretion in our body, and ultimately leading to increased sugar levels in our body. However, the most important risk factors for developing diabetes would be the lifestyle, especially the modern lifestyle with lack of exercise, lack of physical activity, a kind of sedentary lifestyle is one of the major risk factors for diabetes. Less work, less exercise, and abundant availability of the food is a major risk factor for causing diabetes. Of course, the food having excessive sugar, excessive saturated fats can lead to diabetes. So excessive consumption of sweets and relatively less physical activity is one of the major risk factors for diabetes. Even obesity is one of the risk factors for developing diabetes. Constant stress, anxiety, these factors they lead to hyperglycemia, especially stress. It can increase the blood sugar level. And if a person is under constant stress, the blood sugar levels will be always high. So to prevent diabetes, to control diabetes, it's very, very important to alter, to change various lifestyle risk factors. Also, one of the risk factors is malnutrition in childhood, especially lack of proteins during childhood can lead to diabetes in adulthood. So, apart from treatment, apart from medication, it's important to change the lifestyle, control the blood sugar levels, to control diabetes, and try and maintain a healthy life. We mentioned earlier that diabetes is an endocrine disorder. And the major defect is with the endocrine gland of pancreas and the hormone insulin. But there can be some other endocrine causes which can lead to diabetes. For example, excessive functioning of the pituitary gland, excessive secretion of growth hormone can lead to diabetes. Or even in hyperthyroidism, Graves' disease, there can be development of diabetes. Also, too much secretion of glucocorticoids because of the hyperfunctioning of adrenal glands can also be a cause for diabetes. So, excessive functioning of the pituitary, the thyroid gland, or even the adrenal gland can also be the reason of diabetes, of high blood sugar levels. The main organ, the main endocrine gland which is involved in diabetes is, of course, pancreas. Now, this pancreas, it's a mixed gland. It is an exocrine gland, and at the same time, it's an endocrine gland. The exocrine gland secretes the pancreatic juices, the digestive juices, which are drained into the gastrointestinal tract, and they help in the process of digestion. The other part, the endocrine gland, has two types of cells, the alpha cells and the beta cells. Now, these two different cells synthesize two different hormones. They secrete two different hormones. The alpha cells secrete glucagon, and the main hormone related with diabetes, insulin, is secreted from the beta cells. Now, functionally, insulin helps to reduce the blood sugar levels. However, another hormone secreted from the same pancreatic gland, glucagon, helps to increase the blood sugar level. So the alpha cells, they secrete glucagon, and its function is to increase the blood sugar level, and the beta cells of the pancreas secrete insulin, and the function is to reduce the blood sugar level. The location of the pancreas is mostly in the center, in the central line, the midline, and it is in the upper part of our abdomen, just near the liver, below the stomach, is the position, is the location of our pancreas. And the main function, of course, is maintaining a normal blood sugar level. Talking about the functions of insulin, The main function is to reduce the blood sugar level. So insulin carries the glucose from the blood inside the tissues, inside the body cells. So the sugar level in the blood is reduced. But the cells will receive glucose, will receive sugar for the process of energy production. Another function of insulin is in the formation of glycogen. Glycogen is a storage form of glucose. So excessive glucose can be stored in the muscles, in the liver, in the form of glycogen. And insulin helps in this process so that it removes the sugar from the blood. Now, some other complicated functions of insulin are also involving protein synthesis and growth. It also helps to convert excessive glucose into fats, and at the same time, it prevents the formation of glucose from other non carbohydrate source. So, in short, insulin helps the body to utilize glucose and reduce the sugar level. Insulin helps the body to convert excessive glucose into glycogen, and then it is stored in our muscles or the liver. Insulin also helps to convert excessive glucose into fats. It will also help in protein synthesis and prevent the formation of glucose from any other sources apart from the carbohydrates. The metabolism process involves the formation of glycogen for storage, and the process is called as glycogenesis. So this process is enhanced by insulin. There are other processes like glycogenolysis, which means converting glycogen to glucose. And the third process is gluconeogenesis, which means formation of glucose from a non-carbohydrate source. So actually, glycogenesis will reduce the blood sugar level, and glycogenolysis and gluconeogenesis will actually increase the blood sugar level. So there needs to be a perfect balance of metabolism so that the blood sugar levels are maintained within normal limits. There are some hormones which have an action opposite to insulin. The function of insulin is to reduce the blood sugar level. So there are some hormones which actually increase the blood sugar level. So, glucocorticoids from the adrenal gland, glucagon from the alpha cells of the pancreas, and growth hormone from the pituitary gland have a function opposite to insulin, and these three hormones, they increase the blood sugar levels. There are various different types of diabetes. So the first type, type 1, is also called as insulin dependent diabetes mellitus, IDDM. So as the name suggests, this type of diabetes is dependent on insulin. People suffering from type 1 diabetes need to take insulin injections to maintain the normal sugar levels. Usually, type 1 diabetes is diagnosed in early age. It can be even diagnosed in childhood or maybe till the age of around 30 years. Usually, in this type of diabetes, there is reduced production of insulin by the pancreas, or it can be defective production of insulin by the pancreas, or in some cases, there can be absolutely no production of insulin by the pancreas. Usually, the condition is because of some antibodies against the cells of the pancreas, which will cause the destruction of the beta cells. And when the beta cells are destroyed, the secretion of pancreas is not enough to maintain the normal sugar levels. So these people, they need to take insulin from an external source in the form of injections. The next is type 2 diabetes, or it is called as non-insulin dependent diabetes mellitus. So patients suffering from type 2 diabetes usually do not need to take insulin injections, but they can take some medications, oral medications, to stimulate the functioning of the pancreas or to stimulate the proper utilization of glucose in our body. Type 2 diabetes is the most commonest diabetes found all over. Usually, there might not be any presenting symptoms of type 2 diabetes, and it can be diagnosed accidentally or it can be diagnosed during a routine checkup. The main reason for type 2 diabetes is insufficient utilization of glucose by the body, by the tissues, by the cells. So, this non utilized glucose remains in the blood, leading to high sugar levels. Sometimes the insulin receptors in the tissues can be defective. They might not be responding to the insulin which is produced by the pancreas. Also, there can be production and endogenous production of glucose in the liver. The liver has the capacity to metabolically produce glucose. So, if the liver is producing too much of glucose, it can also lead to high sugar levels. So, the reasons for type 2 diabetes can be related with the insulin receptors, it can be related with the utilization of sugar, or it can be also related with the metabolic processes in the liver which increase the production of glucose by the liver. So, comparatively, here we can see that a healthy pancreas produces enough quantities of insulin, and this insulin helps the glucose to get inside the cell through the insulin receptor, and then the cell can produce energy from that glucose. In type 1 diabetes, there is a faulty production or a failure by the pancreas to produce enough insulin or proper quality insulin. So, as the insulin production is faulty, as it is less, the glucose finds it difficult to enter in the cells. And in type 2 diabetes, the insulin production is normal, but then the cells they fail to respond to the insulin properly. The cells might have faulty insulin receptors, or the cells, the tissues, would not be utilizing the glucose in enough quantities. So, as the glucose is not entering into the cell, it will remain in the blood, increasing the blood sugar level. That's the main difference between type 1 and type 2 diabetes. Another type of diabetes is the gestational diabetes, or the diabetes which comes up during pregnancy. Now, this diabetes usually is because of the hormones estrogen and progesterone, which reduce the insulin sensitivity. Also, the glucocorticoids they increase the blood sugar level during pregnancy. Sometimes the liver is also triggered to produce more amount of glucose so as to prevent starvation of the growing baby. So all these factors slightly increase the blood sugar levels during pregnancy, and this condition is called as gestational diabetes mellitus. Now, once the baby is born, usually this diabetes it goes away. But in some cases, after the childbirth, it may continue as type 2 diabetes. Usually, no treatment, no medicinal treatment might be necessary for this gestational diabetes. It can be mainly managed with diet and lifestyle changes. But in some cases, medication might be necessary for gestational diabetes. The fourth type of diabetes, which is usually uncommon, is malnourishment diabetes mellitus. Now, this is mainly related with the diet. So, a protein deficiency in early childhood can cause developmental problems of the pancreatic gland, leading to diabetes in adulthood. Sometimes some food toxins can damage the pancreas, leading to diabetes. Also, excessive consumption of sugar, excessive consumption of saturated fats, and lack of fibers in the food is also considered as one of the risk factors for malnutritional diabetes. So basically, controlling the food, the quality of food, what we consume is important to control malnutritional diabetes. The clinical signs and symptoms of diabetes. The main signs and symptoms are considered to be polyuria, polyphagia, and polydipsia. It simply means excessive urination, excessive hunger, excessive appetite, and excessive thirst. Now, the sugar levels in the blood are high, but then the cells they are not receiving enough sugar. The cells are starving, and as the cells are not receiving enough sugar, the brain wants to get this sugar, and for that, the hunger is increased. Also, this excessive sugar in the blood is thrown out through the urine, so the amount of urine flow is increased. And lastly, because of this high sugar levels in the blood becomes a bit thicker, and to dilute it, the person needs more water. There is excessive thirst. So, excessive urination, excessive hunger, and excessive thirst are considered important symptoms in diabetes. But even though the person is eating more, there is fatigue and weight loss. So a diabetic person will get tired very easily because the cells are not receiving enough glucose, enough sugar for energy production. So the energy levels in these people will be low. High sugar levels can also have an effect on the eyes. It can damage the retina of the eyes. Chances of early cataract are more in diabetic people. And also, the vision will not be clear, it would be blurring. So, the eyes would be affected in a person suffering from diabetes for a long duration. So, monitoring the eyes, a regular checkup of the eyes in a patient suffering from diabetes is very, very important. Also, these sugar levels can lead to cramps or tenderness of the muscle. The muscles can be painful. So, for no reason, there is tenderness and pain of the muscle. Delayed wound healing is another hallmark of diabetes. And infections in the wounds can also be quite common because the high glucose levels are a ready food for the microorganisms to grow, leading to infection. So, delay in wound healing and infections is also quite common in a diabetic person. Also, there can be infections of the vulva and the penis. It can lead to itching in the groin and, in general, itching of the skin. The immunity is reduced in a diabetic person. The nerve reflexes or the tendon reflexes, they are reduced, they are slowed down, and in general, there is a loss of sensation, especially the pain sensation. Complications of long standing diabetes can be atherosclerosis, hypertension or high blood pressure, and then further coronary heart diseases. The atherosclerosis can also become a risk factor for brain stroke. So, atherosclerosis, because of diabetes, can be a trouble for the brain, can be a trouble for the heart. Also, polyuria, excessive urination because of too much of sugar, will be a reason for excessive functioning of the kidney and it can lead to complications of the kidney function or even kidney failure in a diabetic person. So the complications of diabetes can be seen in some important organs like the eyes, the heart, the brain, and the kidney. Also, in some cases, there can be enlargement of the liver. Another complication can be diabetic ulcers because of the delayed wound healing and infections of the wounds. So, the wounds in a diabetic person can convert into ulceration, and these ulcerations may not be very painful because the pain sensation is lost. So, it's very important to maintain the sugar levels within normal limits, even in a diabetic person, so as to prevent all these complications in the patient. Now, what should be the aim of treatment? The first and the foremost aim of treatment is to get relief from the symptoms. Then the second aim is to reduce the blood sugar level. And it's also important in a diabetic person to have normal weight. And the main aim of treatment would be, as far as possible, prevent or postpone the complications related with the major organs in our body. Lastly, the management of diabetes is based on three things. Number one is diet. Number two is physical activity and exercise. And number three is proper medication. So, to control diabetes, it's important that all these three factors, diet, exercise, and medicine, are balancing out each other. We cannot neglect any one of these three factors. Hari Om.